Now, Georgia Republican Tom Price, chairman of the House Republican Policy Committee, is a member of the Budget Committee and the Republican Doctors Caucus, a physician himself. And, sir, good morning.
Good morning to you. Thank you so much.
Welcome back here to America's Newsroom. Now, you allege that this panel is the beginning of rationing of health care in America. How?
Well, it is, because what it is 15 individuals appointed by the president and, yes, confirmed by the Senate, but they don't necessarily have to be folks who have any specific knowledge about taking care of patients. They may have knowledge about the health care system, but not taking care of patients. And what they're empowered to do is to reduce payments or not pay physicians for providing care to patients. That's denial of care. You can call it rationing, anything that you want. But what it means is that the federal government, as we suggested last year when this bill was being discussed, is going to get between the patient and the physician, and that's wrong.
Well, you're a physician yourself, and you know that better than all of us, than we do. And Dr. Mark Siegel, frankly, was here making the same point yesterday. Come back to the point about the law, though. This panel is established to reduce costs. Isn't that the goal in the end anyway?
Well, it is, but there are ways to reduce costs that increase the quality of care, and there are ways to reduce costs that deny care to patients. And the administration and the Democrats here in Congress have elected to deny care to patients. That's how they save money. We believe that you decrease costs by having the system be more efficient, more accountable, more transparent, more competitive, all the kinds of things that you and I both know and your listeners know actually bring down costs.
This is what Paul Ryan tweeted late yesterday. He said, plenty of misguided government expansions buried in the 2,700-page health care reform law. But today's hearing is focused on page 1,000, section 3404. That's the whole idea about passing it before you know what's in it. Who found this on page 1,000? And I mean, you as a doctor, did you know this panel existed when health care reform came up for a vote?
Yes, in fact, we talked about it. We talked about the rationing capability of this bill and the denial of care capability. It didn't get the kind of attention that it should have at that time because, as you'll remember, everything was kind of rolling very, very fast. But what we were concerned about is what is coming to pass, and that is an unelected board, 15-member board of bureaucrats, those folks employed by the federal government, who will determine whether or not your doctor can provide the kind of care that you as a senior in this country need.
15 people can tell you, Tom Price, whether or not you can get a hip replacement surgery.
That's exactly right. And it's even more pernicious than that, because what it means is that if the physician has had something denied in the past to a senior citizen in terms of care, then that in that physician's mind, in the next patient that comes in the door, it's, well, I won't even offer that to this patient because I know it'll be denied. So the patient then loses that trust in the physician, and I would suggest that it's that patient-physician trust that allows us to have the highest quality health care in the world.
I understand the point you're making. What's a better solution then?
Well, the better solution is to allow patients to have the opportunity to make decisions about who they see, where they see them, how they're treated, when they're treated, and by whom. And that's the kind of solution that we've put forward, which puts patients in charge, patient-centered health care. That's the way to move, as opposed to having government-centered health care, which is what the president desires.
I know you want this repealed. If it were repealed at some point, this would be out. We'll see where the hearing goes today. Tom Price, thank you for coming back, okay?
Thank you so much.
All right.